valves, pressure volume loops, disease. So let's start with aortic stenosis. What's the first thing you're going to notice with aortic stenosis? You know, whoa, holy moly, the volume's going to decrease. Right here, your systolic volume is going to actually end up increasing. Yikes, no good. But what else? Well, holy moly, look at all this left ventricular pressure that we have building up. Why is that? Well, it's because the aortic valve's lost the nose. The aortic valve allows whatever's in the left ventricle to leave. So if it's harder for it to leave, pressure is going to increase. Again, it's a Le Chatelier principle kind of thing. What's going to give everything away here is that the pressure in the left ventricle is going to be greater than the aortic pressure. Now, why is that? You know, we can go up and see how usually they're pretty similar. Well, why would they be similar? Well, because the left ventricle and the aorta, they're so close to each other. When everything ejects from the left ventricle, it kind of hits it goes into the aorta more or less at the same speed, at the same pressure, at the same, whatever, you get it. However, in this case, the barrier is, hey, it's harder to get into the left, it's harder to get into the aorta. So you have a stressor, and so the body acts to counteract that stressor. Boom, we'll just increase the pressure. And there we go. All right, mitral regurgitation. So you can kind of see here when you look at your normal pressure volumes and stuff. Here it's way different. And what are the big things that you have to keep in mind is into the left atrium, you have a whole bunch of regurgitation that's happening during systole. And something that I didn't highlight, but I'm highlighting right now, is the tall V wave. Well, why do you think you have that tall V wave? Well, we can look right here. Here you have pumping out, and at the same time you would have a V wave. Okay. But the V wave in this case is very tall. Why is that? Well, remember that when you're looking at your JVP, which is where this V wave is coming from, you're looking at the JVP, you're looking at the right atrium. Okay? It represents kind of the filling, the passive filling. They have you remember it as filling. Okay. However, during mitral regurgitation, your mitral valve isn't really working too well. And so that means that when you have systole, right here, you have some of the blood going back up into the atria, and it's pushing against the wall just a tiny bit, just a bit, but it's enough to have an increase in this V wave to more than it would usually be. So again, the reason why you have a tall V wave is because the regurgitation is going up into the atria, kind of pushing against, right here, kind of pushing against the right side of the heart a little bit, pushing against the wall, which causes an increase in that chamber. All right, aortic regurgitation. All right, what's going to give this thing away? It's the pulse pressure. Every single time, it's the pulse pressure. Yeah, you know, you might have an increase in your systolic pressure a little bit, but what's going to really give it away is the difference between systole and diastole, or systole and diastole. Okay, so you have to kind of think about, well, why would I have such a decrease? You know, when I compare it right here, when I compare it to a normal, nice kind of graph, why would that be? Well, you can kind of think as, you know, systole and diastole is pressures in the aorta during different times. Oh, sorry. I meant systolic and diastolic pressures. It's the pressure in the aorta at those specific times. So systolic pressure in the aorta during systole, diastolic pressure in the aorta during diastole. And so why do you have this decrease right here during diastole? Well, the reason is because, you know, the blood, as we know, during aortic regurgitation, the blood in the aorta is leaking back into the ventricle. This is allowing you at the same time to have a greater end diastolic volume, because now you're getting kind of, you can think about it as getting blood supply, you know, not just from the atrium, but also from the aorta, because it's leaking back. So you have this kind of ballooning and dilation a little bit of the left ventricle. However, during diastole, the diastolic pressure, it's so low because typically when you have filling or when you have filling of the left ventricle, that's when the blood is kind of, it's already like left the aorta and stuff. But remember, because of the regurgitation, that you have that blood, not all of it's going back out, and it's going back into the left ventricle. So to re-summarize, because I might have explained that a little bit poorly. Aortic regurgitation, you have a lower diastolic pressure because during diastole, all the blood that would usually be going out of the aorta, the volume has decreased and it's going back into the ventricle. And so you have less of that blood there, less of the pressure, decrease in the pressure. And mitral stenosis, the big thing you got to remember here, the pressure in the left atrium is going to be bigger than the pressure in the left ventricle. Why is that? Well, you got to keep in mind that the mitral valve is giving you the gateway between the atrium and the ventricle. As a result, if you have a stressor on the system, as the Le Chatelier principle kind of tells you, you're going to act to counteract that. So you're going to have to push things through. Boom. Okay. And of course here, the big thing isn't you're going to have a greater left atrial pressure than a left ventricular pressure during systole. That's not what they're saying here, okay? But when you look at your normal JVP, and you look at your normal the normal pressure in the ventricle and the atria when you're not going through systole, it should be pretty nice. It should be, look at this, it should be pretty similar. However, here that's not the case. Why is that? It's because of the stenosis. It's because you have a blockage, and so as things work with Le Chatelier's principle, you're going to act to counteract that stressor. How are you going to do that? Increasing the pressure, getting things through. Okay.